Download your favourite apps with Huawei Petal Search. Download now.
Well, kia ora koutou katoa. Welcome back to Manatū Hauora, the Ministry of Health, and thank you for making the trip up the road. It's a beautiful day, so hopefully you enjoyed adding to your steps for the day. Now, there are 9 new confirmed cases of Covid-19 to report today. All are in the community, and there are no new cases in managed isolation facilities from travellers coming across the border. 7 of the new cases have already been linked to previous cases in the cluster, and we have a total of 4 cases that remain under investigation, including 2 of the new ones, which have arrived very recently into the database. Based on the information available so far, they are all believed to be linked to that same community cluster. Now, as of 6 o'clock last evening, 86 people linked to the cluster have been moved into a quarantine facility. That includes 36 people who have tested positive and household contacts. There are 5 people receiving hospital-level care for Covid-19 currently. 2 are in Auckland City Hospital on wards, and 3 are in Middlemore Hospital also on wards. The 3 people in Middlemore had been transferred from the Jack Park facility, and all are people who are connected to the cluster. So the 9 new confirmed cases today bring our total number of cases to 1,280. That is our total number of confirmed cases. And the total number of active cases is 78, of which 58 are our cases that relate to this community cluster, and 20 are imported cases that are in managed isolation, actually in our quarantine facility. Moving on to testing, we're continuing to see record levels of testing, and our labs are continuing to meet the demand for levels we have not previously seen before or processed. And yesterday, our laboratories around the country processed 26,014 tests for Covid-19. So the total number of tests completed since the start of the pandemic in New Zealand is 597,956, of which almost 100,000 have been completed in the last week or so. Now, as previously reported, because of the high volumes, there can be delays in processing at the labs of up to 48 hours, but the labs continue to prioritise the tests that are from people who might be at higher risk of returning a positive result, that is close contacts or others who have had contact with one of the existing cases. And just a reminder, only people who have symptoms should be seeking advice and or presenting for testing, so we can ensure that all the swabs are processed as quickly as possible, which helps us define and contain the outbreak. So testing at the border for workforce at both airports and ports has continued to increase. There's a dedicated testing team with extended hours now at the ports of Auckland to ensure good access to testing there for the workforce. There is also testing of all government agency frontline staff at the Auckland border, Customs, Biosecurity, Immigration New Zealand and Aviation Security, all either complete or about to be completed. There's a new team that's gone into the Tauranga port just this afternoon, and over the next few days that will be supplemented with additional testing people, so they will be able to test several thousand workers at the port of Tauranga over the next few days. We're also continuing to test staff working in managed isolation and quarantine facilities around the country, and in Auckland where more than 2,500 staff work, over 2,100 had already been swabbed on site, and by the end of yesterday, and of course quite a number will have also been tested by their GP or at CBACs. Just a word on casual contacts, and understandably there is a significant interest and in some cases some anxiety around casual contact tracing activity from organisations or locations where cases may have been for a shorter or longer period. Now, our contact tracing processes do involve in-depth interviews, often more than once, usually more than once, with confirmed cases to get a full picture of anyone that they may have been in close contact with, and likewise other places they may have been, just to help with our casual contact tracing. Now, many of the reports in the media are of organisations or locations being closed due to positive cases having been at that location for a period. However, in most of these instances, the people who were there at the same time are simply casual contacts, and all they need to do at this point is to monitor their health and get advice from GP or Healthline if they become unwell. Some casual contacts, depending on the situation, may be asked to be tested, and they will be asked to be isolated or self-isolate until the test results come back. We've been using the COVID Tracer app to contact or notify people in some of those relevant locations and times when they have scanned in, and I've asked the team to also publish those location and time details on our website. So some locations of interest over the last 2 days are the Botany Mall between 1 and 2 p.m. on the 11th of August, Butterbean Motivation between 5:15 and 6 a.m. on the 10th of August. That's a fitness class at School Road in Kingsland. Then Eden Junior Rugby Club in Gribblehurst Park, Sandringham between 5:30 and 6:30 p.m. on the 11th of August, and also a guinea pig show at the Auckland Cavvy Club in Hall Road between 10 a.m. and 2 p.m. on the 8th of August. The important note here is that the risk from these locations is invariably very low, so people should not feel the need to avoid those areas or organisations. This is just simply of us casting a wide net and making sure that anyone who might have been in those locations is aware and to be aware of symptoms. On to the NZ COVID Tracer app, which has now recorded 1,442,300 registered users. That's an increase of just over 68,000 in the last 24 hours. There are now 210,266 QR codes generated, an increase of over 16,000 in the last 24 hours. And in the last 24 hours, there were 833,020 poster scans undertaken. And the total number of poster scans is now over 6.2 million. So great to see New Zealanders not only registering with the app, so we have their up-to-date contact details, but also using it. Just moving on to the testing, the environmental testing at the Mount Wellington and Americold facilities. The swabs were taken over the weekend and flown to ESR here in Wellington for testing. It will take some time to process all those swabs. There is a number, and it's quite a sophisticated and indeed novel process for this virus. We need all those tests to be completed to get a full picture, and they are expected during the week. We will, of course, outline those results as soon as they're aware. I should say that even if some of those swabs return a positive test, the challenge will be in determining the direction of any contamination that might have occurred, and it may be difficult to get any RNA material that will be from those environmental swabs, which can then be genome sequencing, but obviously that is the aim if we possibly can. On a related note, supermarkets have said that some customers are concerned about frozen goods, and a reminder that the New Zealand Food Safety team has reviewed the most recent science from around the world on being infected with Covid-19 through contact with food and food packaging, and there's no evidence of transmission via food or food packaging to date, and remembering that those goods that come through Americold have a number of other layers outside them in addition to the packaging of the actual food. And of course, I need to give a plug for normal hygiene procedures, so frequent and effective hand washing and use of alcohol-based hand gels before preparing food is of course ideal and recommended. So finally, just to reiterate the point I've been making, this is a tricky virus. The virus is the problem, not people. We are all collectively the solution, and it's been heartening, very heartening to see the number of people coming forward to be tested. And those who have tested positive are to be commended on the fact that not only did they come forward, but they then have assisted in detailed follow-up so that we can find where this outbreak is and ring-fence it. And I'm certainly wanting to commend them for their actions, and I think they deserve nothing less than our thanks and praise. I'm happy to take questions.
Dr. Whitfield, last week the Prime Minister said that there was regular testing at ordered and managed isolation facilities. However, by your and the Health Minister's own omission, that wasn't taking place. Did you mislead the Prime Minister or Cabinet about this?
No one was misled. What I would say is that there was testing happening at our managed isolation and quarantine facilities around the country. It was rolling out and scaling up. And just to put that in perspective, and I've said this several times, including I think last week, there are 32 managed isolation facilities with a large number of staff, and we were working up how to ensure that all the staff there were tested, including the hotel staff as well as those on secondment, remembering that they are working shifts. Some of those staff were also being tested in the community. For example, Defence Force staff at Linton and Ohakia were being tested once they had gone back off their shifts. So it was rolling out. We were increasing the frequency of that testing. But just to reiterate, there was testing happening, and at the same time we were also rolling it out for our staff at the airports and at our 17 ports around the country, but not all of that testing could happen at once, so it was scaling up.
But the Prime Minister's clear expectation was that was already happening, and what you're telling us today that it was being rolling out. So where's the miscommunication there? Why was she and Cabinet thinking that it was already taking place, whereas you're telling us today that it was actually a process leading up to that point?
Well, just to affirm the point I made, actually testing was happening, and if we go back and look at our managed isolation facilities, they had all had some testing happening. What was scaling up was the size of the teams and the frequency with which they could go back into each facility, and that was taking some time, remembering this was being done under Alert Level 1, where our health system is providing care right across the spectrum for New Zealanders. I can say that we were working very closely with the DHBs in Auckland, as well as in Canterbury and here in Wellington, to make sure that the testing was being ramped up to test everybody. And at the same time, and I want to make this point too, this was an adjunct to a number of other things we were doing, including independent infection prevention control audits of the facilities, and we had introduced a number of new measures like masks for all guests from plane to room when they first arrived, and much wider use of masks in the facilities.
We've been told that some people are waiting up to 5 days to get their test results. Is that good enough?
Look, it is a pity that people are having to wait that long, but I just want to reiterate the points I've made in the last couple of days. Is it can take 48 hours for that lab turnaround. If the result is positive, there is immediate action, and the tests that are more likely to be positive are prioritised. I know that it can be a nervous wait for people, and I do want to acknowledge that, but you'll see from the volumes, which are really, really high, that our labs are doing a fantastic job of processing a lot of swabs. I apologise for the wait in getting the results back for some people, but rest assured, if the result was positive, they would hear very, very quickly.
Is the wait for test results a wide-scale problem that you're aware of, and do you know where it's happening most?
I don't know. I suspect there may have been slightly longer delays over the weekend because many general practices are shut, and often it's the general practice that then passes the information through. So my expectation would be that over coming days that wait will drop. If there are specific reports, we will follow up directly with the lab and the DHB to see what can be done to expedite getting the return of results.
Do you accept that second testing policy wasn't implemented as it should have been under your watch?
It was being implemented, and as I say, this was quite extensive testing across a number of sites, a number of workforces. It requires a lot of coordination with ourselves, with those in charge of the managed isolation facilities, those in charge of a range of workforces at the airports. What I can say is that the Minister was very clear that they wanted that testing to roll out as quickly as possible, and we were working with the DHBs and very focused on making sure that happened.
Did you communicate that it wasn't happening?
We were giving the Minister and Cabinet very regular updates on the extent of that, and based on our updates, again, they were making sure on a very regular basis that we were quite clear about the imperative to get the testing scaled up as quickly as possible for our border workers as one part of continuing to strengthen our border measures.
The Minister's understanding, though, was that the policy had been rolled out as expected. Did you check to see that it was happening?
I was checking every single day, and there was clearly a dissonance between what the Prime Minister thought was happening and what was happening on the ground. But that doesn't mean we weren't providing full information through. So it may be in the way the information was communicated. I think what we've seen over the last few days, remembering again that this is in response to an outbreak. We have seen border workers actually instructed under an order to be tested. I think the other thing I would say is that there was testing happening right across our managed isolation quarantine facilities and also at the airports. But remembering we were in alert level 1, the testing was voluntary, and like other New Zealanders, many of our workers in those settings didn't necessarily feel that there was a need or an imperative to get a test, particularly because every day when they turned up to work, they were being checked for symptoms, including temperatures being taken and so on. So this was another adjunct. Work was happening with unions and others just to increase the uptake of the testing. We're now in a situation with the outbreak where there's a specific order requiring them to be tested, and as you can see, they're coming forward and being very cooperative.
But on a June 20...
Should that order already have been in place right from the beginning?
Well, at the point in time, remember again, we were under alert level 1, and at that point in time, we were going through a process of scaling up the testing availability, working with unions, ensuring that we knew who all the workforces were, who were rotating in and out in different roles, making sure we had that information, and ensuring that even those on night shifts or who were off duty could get in for testing as well. And again, some of that testing we know was happening with general practices, not necessarily at the facilities. It's only now that we have got coding in the labs that will be able to tell us exactly who from those managed isolation facilities has actually been tested.
On a June 23rd press release, the Minister of the Health at the time said regular health checks on and asymptomatic testing on all border-facing workers would be underway. Why would it take so long between now and then to actually get it up and running when we've seen over the weekend that the Minister has implemented it and it's taken place over 72 hours?
Look, I just want to take you back to the whole country, and we know, was operating in an alert level 1 setting. That didn't mean that our border facilities have been at alert level 1. We have been running these incredibly tightly since the 9th of April and put in place a number of strengthening measures since that time. This was another one we were putting in place. We had also put in place the regular testing day 3 and day 12 for all guests there. So again, just think about this as part of the suite of actions that were underway, but we couldn't suddenly flick a switch and test all members of that workforce overnight. We were keeping the Minister and Cabinet very regularly updated on progress with rolling that out.
Okay, so they were being updated with progress. So at one hand, you've got the Prime Minister and the Minister of Health that thought that it was happening. On the other hand, you were updating them. So it's, at the end of the day, was this just a miscommunication?
Well, I think the Prime Minister and Minister were making really clear what their expectation is. I certainly felt and communicated that expectation, and I know that our team and the DHB teams were working extremely hard to get that testing rolled out, and also we were working with our colleagues who are managing those managed isolation facilities as well to make sure the workforces were available so that they could be tested.
And the problem here is that they were under the impression that regular testing was already happening, yet it wasn't happening. And you're saying you were scaling it up and ramping it up.
Yep.
But why were they then under the impression that it was already in place?
Well, I'll just go back to the point I was making. There was testing happening in the facilities.
That's not in dispute. It's regular testing.
And what I'm trying to point out is the challenge and complexity of rolling that out so that it encompassed all of the workforces in all of those facilities, as well as at our ports and airports. And what I don't want to have leave anyone in any doubt is the fact that the teams were working incredibly hard to roll that out as quickly as possible.
Yeah, that's not in dispute either. What's in dispute is they were under the impression that it was happening regularly. Not that it wasn't happening at all, just that it was happening regularly. So where is that?
Well, again, if we go back, most of those managed isolation facilities had teams in more than once. So what we were trying to do was, first of all, capture all the workforce and then increase the frequency of the testing so that it was every 2 to 3 weeks for every member of the workforce. And again, I just want to come back to the complexity here. And we were operating in an environment under alert level 1 where the testing was voluntary. So, look, I don't have anything more to say about that, but I just want to reiterate there was absolutely a lot of activity going on to ensure that all the workforces would be tested regularly.
But in your mind, there's been no failure here?
No, I don't think there's been a failure. I think that I know there's a desire to look for a point of failure here. Our border systems we have been continually strengthening. We have added in the testing of workforce, which was being scaled up as part of belt and braces. We have added in audits of infection prevention and control. We have added in the wider use of masks. We have got really clear procedures and protocols.
I understand that, but the Health Minister has said that there has been a failure and he has accepted responsibility for that. You disagree? There has been a failure.
I don't think he said there was a failure. I'm pretty sure, because I was
He said the testing hasn't been done as he expected.
Yeah, I think that's right, and what I'm saying is that the expectation was that all border staff would be tested regularly, and that was what was being rolled out.
Do you accept responsibility for not meeting the Prime Minister's expectations?
Oh, look, I've talked about this with the Prime Minister and Minister of Health, and my sense is what they're really interested in is how we make sure that that testing does scale up and be available regularly for all border staff. At the moment, of course, we've got a huge workforce that is out there doing that as part of the response to the outbreak, and again they're working around the clock to make sure that happens. So I feel the keenness of their expectation and the responsibility that I have to make sure that ourselves and the district health boards, who are the operational arm of the health sector, deliver on what that expectation is.
Investigating the supply chain from the Americold facility back through the ports and through the shipping workers and stuff like that. How's that investigation going? Is there any update on that?
I don't have an update on that sort of end-to-end investigation. There are a couple of things. I've mentioned the environmental swabbing from the facility in Mount Wellington. We're also expecting back to date today, I hope, the results of the testing of Melbourne-based workers who work in the Americold setting in Melbourne, or facility in Melbourne, and the lab there is doing the genomic sequencing there just to see whether it's a similar or a different pattern to the genome sequencing from the outbreak we have here. So that will be, again, another small piece in the puzzle that will help us possibly rule in and also possibly rule out whether there is a link there.
Is it still the main focus of the investigation?
Look, it's one focus. I wouldn't say it's the main one. We still don't have any particular clues as to what the origin of the outbreak is. Our first focus is on course on mapping the full extent of it and the full extent of infection, and then managing that outbreak. It will be, once we have that complete picture, we are much more likely to be able to then go back and trace the origin of it. And, you know, it's somehow the virus has come in across the border. I think we're confident that it wasn't brewing away or a sort of a slow burning ember in the community. The question of where it's come across the border and how is what we're trying to answer, those two questions. We may find some clues as to where, but we may still never quite answer the question of how it was transmitted, but we'll do our best to do that.
Do you feel you're close to having the contours of the cluster?
Look, I think we're getting closer all the time. Again, if we look at the number of new cases today, given the extent of testing that has happened over the last few days, I think that's encouraging. And the fact that we've got 4 cases, yes, still under investigation, the genomic sequencing will help there, but the sense we have is that we are dealing at the moment with a single cluster, a single outbreak, and thanks to the efforts of the community in coming forward for that testing, we're getting, I think, a full idea, as you say, of the contours of the outbreak.
So we have spoken to some workers at the ports who say they've been given conflicting advice about whether they can work or not until they've had their test results. What are the rules on that, and do you know why they would have been receiving conflicting advice?
I can't say why they'd be receiving conflicting advice. Can I just check, is this at one port in particular?
I think it's particularly at the port of Tauranga.
Tauranga. I will check that, yes. The advice is, actually, there are sort of some members of the workforce who are at slightly higher risk, perhaps, of being exposed, like the pilots who go out to the ships, and/or stevedores who might be more likely to have contact with the ship's crew. So there may be a differentiation in advice for those people compared with those who are much more casual, who may have just been driving trucks in and then out and not had any contact. But I can check that.
So for truck drivers, if they haven't received a negative test result yet, they can keep working?
I don't want to preempt what advice they have been given, but I'll definitely follow that up and make sure it's consistent.
Just given Taranaki hapu Ngāti Rangi and some of the hapu in Te Tai Tokero are planning on making regional bubbles. Is that something that you would encourage?
Well, at the moment we've got the whole of Aotearoa outside of Auckland at level 2, and there's no particular reason at the moment to create regional bubbles or further boundaries, as it were, around specific regions. I know that some of those iwi, both there and elsewhere, and other communities have concerns, and I suggest that they, if they're not already, and I suspect they are, that they're talking with the local DHB and with those in central government who are leading some of those conversations with communities. Certainly at the moment, as we just described, aside from the 2 cases in Tokoroa, there's nothing that has shown so far that there are any cases outside of that Auckland region. So that's encouraging, and I think that iwi should take some comfort from that.
When it comes to being just some community cases, we've been hearing from people who are just wondering, when they go into quarantine, can you tell us who exactly will be going into quarantine? Because it seems from the data you've provided today that there's about 2.4 people going into quarantine for every case that goes into quarantine. Mm-hmm. Is it entire family? Say if you're a single parent with 1 kid, is your kid coming to quarantine with you?
What we're generally trying to do is encourage, especially where it's helpful for families, is that the case and any close household contacts who might be at risk of still developing the infection or showing infection, that they go into quarantine. They're kept separate in the quarantine facility so that it absolutely reduces the risk of passing it on to other household family members or other household members. So that's why we see, so some of those will be just individual cases there, but others will be the whole family in there. And again, the main, one of the key drivers of this is to protect the rest of the whānau members from that infection that's very common inside the household if there's not that isolation of the case or cases from other family members.
And for people who are in Auckland right now, some people are asking, they're saying that the government's advice on masks is a little vague. The government's advice is you should wear a face covering when you're out and about. Does that mean, is that limited to public transit and stores? Does that mean you should wear it once you leave your door? If you're in a park, if you're on a beach, when should people be wearing masks?
Well, I always think of out and about as out from my house or my workplace and about in the community. So it's encouraged both indoors and outdoors, but of course the main place is when you're in an indoor environment with people who aren't inside your work or household bubble.
So just in your mind though, you leave the house and you mask up?
That's right, yes.
And the ministry, in terms of testing at the port, that initial time frame was meant to be midnight tonight. So is that now redundant? Has it been extended? And how risky is the port in terms of allowing the virus in?
So a couple of questions in that. On the first one, I've been working with the Minister to extend the initial order, the time frame, because of the sheer numbers of workers that needed to be tested, and we've been working really well with the DHB and the ports, both Auckland and Tauranga, to get more testing capacity there, and also to prioritise the workers who should be tested first, and then others who are much lower risk a bit further down, a bit later in the week. So yes, we've extended the time frame there. There's no one's going to be penalised if they haven't had their test by later tonight. The ports is an area that there's been quite a lot of focus on already over the last few months, and in particular over the last 5 or 6 weeks, where there's been that specific order in place which has been preventing crew from disembarking vessels other than very close to the vessel as required for tying up and unloading and keeping that physical distancing from port workers. So I don't think it's necessarily a high risk way that the virus could get into the country, but it's part of our really trying to cast the net wide and find, is there potentially some risk of infection at the port?
And do you have revised figures on how many workers or people you think you need to test now for those ports?
Look, it's quite hard to get the denominator. It's several thousand. What I can say is that by 5 o'clock yesterday, there were well over 1,000 from Auckland Port and that had been tested, and maybe even higher, and that in the ports of Tauranga they will be able to get through 2,000 to 3,000 just over these coming few days.
You mentioned that revised date now a specific time or just as it comes up?
Actually, the order's with the Minister at the moment, and I can't remember the exact date, but that will be signed and published, so I don't want to steal this.
Have you seen comments from the Ports Chief Executives Group spokesman Charles Finney? He said that the ports have been trying to get tested and have repeatedly requested testing at the port as recently as 2 weeks ago, but haven't heard anything about it.
Yeah, there was testing at ports, not all ports, from several weeks ago, and starting with a number of ports. And again, Littleton, Auckland was one of the first ones, and again was rolling out around the country, starting with those that we thought might be at higher risk. So yes, that again was another site that we were rolling out testing, both of the government workforce, so the customs and other MPI staff, but also of those working in the ports. The challenge with ports is also that there's an enormous number of people that come and go into the port operation. So it's working out who are those who might be at higher risk and trying to focus regular testing on those groups.
His comment was sort of implied that their pleas were just being not heard.
Oh, well, I just have a different view from Charles on that one.
You mentioned that the American...
We'll just go over here.
Yeah, thanks. Just on a specific matter around the testing, it was said that quarantine workers were being tested weekly, routinely. When did that begin, if it did begin?
Look, I don't have the exact date, but it was, we were moving to weekly for our quarantine workers because they were more likely to be...
So it hadn't begun weekly?
The testing had begun and was moving to weekly. And again, I'd have to go back and look at the dates there.
Could you say that it began maybe 2 weeks ago or 3 weeks ago?
I couldn't. I'd have to go back and look. What I can say is, and I've visited the quarantine facility, the Jet Park in Auckland, is that it's got the strictest protocols around infection prevention control, separation of people who are COVID positive from others. The staff there, as I said, have daily symptom checks when they go in, and any symptoms were being swabbed and have been for some time by the medical officer who's on site there.
So by that, are you saying you're fairly confident that if the virus emerged across the border, it didn't come from one of these quarantine facilities?
We simply don't know. What I can say, just to reiterate the point, is that we've had these arrangements in place since the 9th of April, and they've proven so far to be really good. And we have done nothing but strengthen them since, remembering that we added in the double testing of all people before they could depart. We've been adding in the testing of staff, but also the testing is only one thing. Even if we were testing everyone every 2 to 3 weeks, just a reminder that a number of these cases we have found in managed isolation and quarantine, the person's tested negative on day 3 but then positive on day 12. So the testing is one part, but by no means the main part of keeping both staff and their families and the community safe.
Just on the people in hospital, are they all in stable condition? Are some serious? Any concerning factors like old age or anything like that?
All 5 are on the ward, and at this point the information I have is that all are stable.
You mentioned that the tests are being sent down from Auckland to Wellington in the Americal storage. Does that mean that the going theory right now, or the strongest theory, is that COVID-19 was brought into the country via the cool storage? Or is there anything that we could read into that? What's the latest theory?
There's nothing on the fact that it's just that the swabs are processed by the ESR lab here in Wellington. And I was saying a bit earlier on, I think, it's a possibility, the environmental contamination. It's probably a lower possibility than the fact that there was some transmission at some other point in the border, human to human. But again, that could have been direct human to human, or it could have been human to a contamination of a surface to human, and this is what we're trying to find out.
So that somebody from another country contaminates it, then it comes to New Zealand, and then somebody from New Zealand picks it up from the contaminated surface.
Yes, and where that may have occurred, of course, is somewhere at the border, which could be at a port, it could be at an airport, or it could be at one of our managed isolation facilities. That's what we want to find out.
Some businesses in Auckland that have had to close are saying that they can open safely, just like a supermarket or a dairy. What's your response to that?
The criteria around who can and can't open under Alert Level 3 are the same as they were last time, and we've not changed that at all, and we'll stick with that for the meantime. Remembering what we're trying to do here, the purpose of that is to reduce the movement and the interaction between people. We know that's worked well for us in the past, and our aim is, if we can do that quite rigorously, we can be in an Alert Level 3 and 2 posture for the shortest amount of time possible. That's the aim. Yeah.
A lot of them, though, are obviously hurting quite a bit more this time round than they were the first time, and some will quite probably argue there's not much of a difference between a butcher or a grocer and, say, a dairy.
Yeah. Yeah, this is certainly something that was very well traversed last time, and just in terms of supporting businesses, you will have heard the Minister of Finance talk about that extension to the wage subsidy and other measures to support businesses who may well be really challenged by that, by the alert levels.
Is there
Knowing that there's a lot of fear and anxiety building within Māori and Pacifica communities, especially in South Auckland, what's being done to help support the mental well-being of those communities? And if there's something being done, how can these communities access that?
So I don't have the details on that, but what I can say is that our team here in the Ministry, as well as the DHB team, Pacific Whānau Ora provider and the Māori Whānau Ora provider, plus the Māori and Pacific health and social providers are working really actively with those communities. My view is they've got really good channels and connections into those communities, and they will ensure that people have access to services if they need that. I can also say that the 1737 mental health line does have people who can speak a range of languages, so that anyone from any of those communities should feel free to use that as well, and they can refer people on to other services if needed.
Is consideration being given to changing the rule that allows international aircrew to fly domestically or travel domestically prior to self-isolation?
Not at this point, but what I can say is we're working almost daily with Air New Zealand around how we can make sure that that is not a potential route for the virus into the country, and they've been incredibly supportive right through that process.
And after there were some reports in the media of international aircrew not complying with the existing restrictions, the Ministry of Health said it would begin auditing for compliance. Has that occurred, and do you know the results of any of those sort of tests?
There was an audit done particularly of the route, the North America Auckland route. We sent a couple of staff up there actually to do that audit of that. It didn't identify any particular concerns. They also did a survey of Air New Zealand staff to find out what the challenges were and also what their experience was. Again, I think it provided us with some clues about how things could be strengthened. And most recently we've done an audit of staff who have come in on non-Air New Zealand airlines and who lay over here for a period at a hotel, just to check that that process is also very robust. I don't have the results of that audit, but again, it's just part of our constantly trying to find any potential weaknesses and address them.
And since the return of COVID-19 to sort of the community cases in New Zealand last week, there have been calls by some commentators that New Zealand should abandon the elimination approach and try something more like Sweden. Do you have any thoughts on that?
I think the elimination approach has served us very well, and most commentators, not just here, but many abroad as well, are supporting us continuing that elimination approach. And I think our aim, of course, is to get back to alert level 1 and to get our economy back up and running at 100% again.
Is there a new achievable target for testing port staff, and if so, how many and by when?
Well, the aim is to test all of those who are in those sort of high-risk categories, and those will be outlined in the updated order which will come out today from the Minister. So the aim is to test all of those within the next by the next 72 hours, and then other port workers who are at lower risk later in the week.
Dr. Bloomfield, just on getting back to alert level 1, the Chief Medical Advisor in Australia, Paul Kelly, I think, has said that he thinks it's dangerous to be in that sort of alert level where anybody can go to a stadium and you can have these mass gatherings. Could you foresee a sort of extended level 2 in New Zealand, or do you think we will get back to that level 1?
I've been working hard on my trying to see into the future, but it's not making much progress. What I would say is, I think this outbreak will give us pause for thought about what alert level 1 looks like and what our kind of minimum expectations of every New Zealander and of each of us might be under that. And it may well be, and I think we should aim to get back to life as normal as possible, but the new norm will, I think, include perhaps a little more physical distancing, more frequent availability and use of hand gels, possibly even use of masks in some settings. Because what I sense is all New Zealanders would prefer that we stayed in alert level 1 and would be prepared to perhaps modify what our behaviours are in alert level 1. So I think that's one of the things we should absolutely look at. There may be that there's somewhere between a 1 and 2, so we can maintain that really open economy and do as much as we would like to around attending large events and so on.
How many of the virus
That's just a couple more questions.
How many of the virus genomes taken from managed isolation and quarantine facilities have been sequenced? Have all of them now been done? Or?
They haven't all been done. All of the ones where the sample was usable, in other words, there was RNA material, have been done, but that is not all of them. And I guess there's a key point I want to make here. Whilst we haven't established a link between the genome and this current outbreak with any of the samples from managed isolation and quarantine from people who have been positive cases there, not all of them were able to be sequenced. So it doesn't rule that out, that there is a link, but at the moment we haven't been able to rule that in.
And the earliest onset of symptoms in this new sort of community cluster was July 31.
At the moment, yes.
What did that person do? Did they stay home after they began developing symptoms, or did they continue to move out and about in the community and go to work for the week or week and a half before the sort of...
Sorry, I don't have the details on that case. This is one of the Americold workers, not the first one who was found, but identified through testing as a close contact. But I don't know what the movements were of that person. What I can say, of course, is that the contact tracing will have occurred right from actually the 48 hours before that person became symptomatic. So 29th of July, any possible places that person might have been will have been followed up. Any close contacts identified, isolated and tested.
Just quickly, Dr. Linfield, do you have a breakdown of how many of the cases are Māori and how many are Pacifica?
I don't have the latest figures, but we will put that on our website when we do an update, and as you will have seen, we're now describing this outbreak distinctly from all the rest of the cases we've had, so that will include an outbreak. My sense is, just thinking about, if I can visualise the table, that there's still a high proportion of the cases are Māori and Pacific.
Do you have a breakdown of the cases of the testing around the country that have been done, the 100,000?
The 100,000, actually we don't, but let's aim to get that up. It will require a bit of analysis over the next, say, 24, 48 hours. So a breakdown by District Health Board and by ethnicity, as we've done in the past, and look at the rates of testing.
Has any border staff tested positive at any point?
Sorry, what was that?
Have border staff ever tested positive?
Have border staff?
You had an MPI worker?
We had an MPI worker, yes, that was quite a while ago, and one of the current positive tests is actually a port worker, but is linked to the outbreak. So it happens to be a port worker, and of course is being followed up, not someone who's has interaction with people at the port, a lot of people at the port, but just coincidentally, because it's quite a large workforce, as a port worker.
Do you know how many
In general, the 26,000 tests and only 9 confirmed to that. That's surely positive signs that the perimeter is being...
Look, it is reassuring, especially because remembering all of our close contacts are being tested as we go through this. A couple more questions.
We've been told that, and forgive me if this is wrong, but one of the people who confirmed positive in Auckland, in fact, lives in the Bay of Plenty and was registered as being an Auckland case due to being tested there. Is that the case? And any concerns about their movements or anything like that?
No, that's not any information I've got at all. But if that is the case, of course, we will notify and make sure that the appropriate contact tracing is done.
Yes, and just back to the whole tension around whether tests were being done of MIQ and border staff previously. You've said that Cabinet was being briefed appropriately, expectation was filtering all the way down. You were explaining to the DHBs what you wanted, etc. The fact that it wasn't quite happening and there's now disappointment at the top. I mean, is the tension really between yourself and the operational arms, the DHBs, the staff on the ground getting things done? Is that where the tension lies?
It's not so much tension, but I just want to point out this is a really complex system, the New Zealand health system, and it's also a system that, by acknowledgement, has been under a lot of pressure. And on top of that, we have been really managing a pandemic in this country very well, and that's required. And you can see just how people across the health system step up enormously as they have over the last week when it's asked of them. So I don't think it's so much tension as just something we need to go back and look and review and find out, are there ways we could make it clearer and make sure the information flows are better in both directions?
I certainly wouldn't want to say that people weren't working hard getting things done, but are you struggling to get some of these finer details, some of these the more granular stuff done at the moment?
Look, we're working at pace, there's a huge amount of goodwill, of course, also involved in things. I think, just to reiterate the point, one of the things we will and want to do is go back and find out, well, was there a breakdown in communication, or if the message wasn't going down and back up as clearly as it should have been, let's sort that out. So we'll do that. Final question here.
Do you know how many vehicles were able to get through some of those checkpoints leaving Auckland, particularly around Te Hana and going up to Northland, and do you have concerns?
I don't have any idea about that. That would be Commissioner Andrew Costa would be able to tell you that. What I can say is I know this morning there was some delays, and that caused some frustration, including for health workers at some of the checkpoints, people who are allowed to cross the sort of the border or the regional boundary, and I know that's something the police are working on to try and get in place some triaging so that people can get through really quickly who may need to get through quicker.
Sorry, just very quickly, Dr. Bloomfield, so you don't think the port worker that's tested positive is a possible clue or a link in this train transmission through the ports, through the shipping?
That worker was identified, as I understand it, as through the close contact testing, and happens to be a port worker. So, if you see what I mean, and the symptom onset was well after the first case of symptom onset we have in the cluster. Okay, thanks very much.
And now featuring Petal Search, your gateway to 1 million apps.